Hi, I'm Pat King. I'm with Aspen University's Nursing 518, and this will be the physical assessment portion of the complete assessment of Tina Jones, a 28-year-old African-American female who came to the clinic today for a complete history and physical for her insurance at her new job, which she'll be starting in 2 weeks. Tina and I have already been talking, and she is alert and oriented ×3. So let's go ahead and start the physical portion of her exam. Her vital signs are normal at 128/82. Heart rate is 78, respiratory 15, and temperature is 37. O2 sat is 99. I'm looking at her eyes. Her sclera is white. There's equal distribution on her lids and brows of hair. Her eyes are symmetrical. Oh, wait. Ooh. Again, sclera is white. No lesions to the lids or around the orbital area. Conjunctiva is pink. Eyes are round. Choose the pen light to check her reaction to light. Start with the right eye, turn on the pen light, and her eyes are equal and reactive from 4 millimeters to 2 millimeters. Check the left eye. Same things, equal, bilateral reaction to light and accommodation. Her pupils are equal, round, and reactive to light and accommodation. So now let's look in her ears, check out with the otoscope, and her tympanic membranes are pearly gray without lesions on the right and also on the left. Nasal mucosa is pink and moist on the right and also on the left, and the septum is in the midline. Check her mouth. Mucosa is pink and moist. Tonsils look like they're about 2+. Check her tongue on the top. No lesions. No lesions noted underneath. No lesions noted on the right or on the left. No evidence of cavities with her dentition, and her gag reflex is intact. I want to palpate her cervical nodes. Which are not palpable bilaterally. Move on to her cardiac exam. Her chest is symmetrical. I'm going to listen to her heart sounds. In the aortic area. In the pulmonic area. At Erb's point. In the tricuspid area. And in the mitral area. Regular rate and rhythm, no abnormal sounds. I'm going to listen to her carotids. On the right, no bruit. On the left, no bruit. Test her peripheral pulses on the upper extremities. The right brachial is 2+. Her right radial pulse is also 2+. In the left arm, brachial pulse is 2+. And on the left, her radial pulse is also 2+. Now we're going to check her lower extremities, peripheral pulses. Start with the right femoral pulse, which is 2+. The right popliteal is 2+. The right tibial pulse is 2+, and the right dorsalis pedis is also 2+. Now then we'll move to the left leg, starting with her femoral pulse, 2+, popliteal, is 2+. The left tibial pulse is 2+. And the left dorsalis pedis is 2+. So peripheral pulses, upper and lower extremities are 2+ bilaterally. Inspecting her posterior chest, it's symmetrical. I'll auscultate her breath sounds. I'll start with the back since I'm here. Ms. Jones has symmetrical expansion. on inspiration and expiration. Breath sounds are clear to auscultation in all fields posteriorly. Anteriorly, the chest is symmetrical. There are sounds that might sound like crackles, but that's more related to the recorder and not the actual sound of the respirations. Breath sounds are clear on auscultation, no rales, rhesus, or rhonchi, anteriorly or posteriorly. Now we'll move on to her abdomen. On inspection, left, anterior, and right, her abdomen is protuberant. Going to auscultate all four quadrants. For vowel sounds, normal active vowel sounds in all four quadrants. Do light palpation, light pressure to all four quadrants. Right upper quadrant, light pressure, no tenderness or masses. Left upper quadrant, light pressure, no tenderness or masses. Right lower quadrant to light pressure, soft, no masses. And then left lower quadrant to light pressure, no tenderness or masses. On deep palpation of the right upper quadrant, no masses. Right lower quadrant, no pain or tenderness or masses. Left lower quadrant, no masses, no tenderness, no pain. And finally, right upper quadrant, left upper quadrant, no masses, no tenderness, no pain. And now we're going to get into the neuromuscular portion of the exam. And we're going to start by assessing her upper extremity DTRs, deep tendon reflexes. Start with the right triceps, which is 2+. The right bicep, also 2+. And her right brachial radial is 2+. Moving to her left side, the left triceps reflex is 2 plus. Her right bicep is 2 plus. And her left brachial radio reflex is 2 plus. So her upper extremity deep tendon reflexes are 2 plus bilaterally. Just want to assess quickly her position sense. So I'm going to type in, because the microphone has never worked for me. Tina, close your eyes and tell me when your fingers move up or down.
Okay. Up.
In the left hand, she appropriately
Down.
Okay, both hands, as far as position sense, are within normal limits bilaterally. Now we're going to move on to the lower extremities and check the deep tendon reflexes there. Start with the patellar reflex, which is 2 plus on the right. The right Achilles reflex is 2 plus. The left Achilles reflex, also 2 plus. And finally, the left patellar is also 2 plus. So her lower extremity DTRs are 2 plus bilaterally. I want to assess her position sense in her lower extremities. So again, Tina, close your eyes and say if your toe moves up or down.
Okay.
Start with the left foot.
Down.
And on the right foot.
I think that was it.
So position sense is within normal limits on the lower extremities with a slow response on the right foot. So because of that, I want to use the monofilament to check her sensation. So once again, Tina, close your eyes and tell me when you feel the touch.
Okay.
Start with her right great toe. The right forefoot under the great toe, she did feel that. The right forefoot under the small toe. No sensation there.
Yes.
Sensation to the right bottom, to the heel of the right foot. Moving to the left foot, the great toe. No sensation. The left forefoot under the great toe. No sensation. The left forefoot under the small toe. No sensation.
Yeah.
She does have sensation in the heel of her left foot. Now then we're going to assess range of motion from head to toe, starting with her neck. We're going to get her to tilt her head back and look towards the ceiling. Now we're going to get Tina to touch her chin to her chest. For lateral bending, Tina, I want you to touch your shoulders with your ears. And then to check rotation, turn your head from side to side. So she has full range of motion in her neck. We're going to check the range of motion in her spine. For extension, Tina, bend back as far as you can. For flexion, bend over and touch your toes, or bend over towards your toes. Good. For lateral bending, again, bend your waist from side to side. And for rotation, twist side to side. There you go. Tina has full range of motion in her spine. Check her hips. Move each leg out to the side. And then move each leg in under the opposite leg. Just like that. For this one, lie on your stomach and lift your heels towards the ceiling. Lying on your back, lift your toes towards the ceiling. Tina has full range of motion in her hips. It should also be noted that she moves freely and easily to all different positions on the examining table. Now, just overall, I'm going to inspect your hair, which is coarse, well, evenly distributed. In general, check her skin from head to toe. She does have pustules on her face, consistent on both cheeks, consistent with acne, which she states is better now that she's on her birth control pills. Also, she's got male pattern hair growth on her face, which she said is also improving with her birth control pills. Tina also has acanthosis nigricans, which is also improving according to Tina because of her birth control pills. right shoulder, elbow, right side is clear, back is clear. She does have a little bitty mole just below her right scapula. On the left, shoulder and elbow, skin's clear. Hands are clear. No lesions seen anywhere. Right knee, left knee, anteriorly, laterally, posteriorly, look fine. Look within normal limits. Let's do her feet and ankles. Get her back around to the front here. Toenails and feet within normal limits, no lesions. And with both her fingernails and her toenails, no ridges or abnormalities. Skin is intact. This concludes the physical assessment portion of Tina's assessment. The only abnormal findings was the diminished sensation in her feet, which might require a referral to a endocrinologist for further evaluation, especially in light of her history of diabetes. Thank you.